Hi, this is Tormod Westvik, and today I'm talking about a comparative study of septal extension graft versus derotation graft for short nose correction in Asian rhinoplasty by Drs. Namgoong et al. From Seoul, Korea. This is a comparative retrospective study looking at 729 consecutive rhinoplasties performed over a 7-year period by the senior author. They looked at 287 patients undergoing septal extension graft versus 142 patients undergoing derotation graft to obtain a longer nose and more tip projection. The Asian nose often have less septal cartilage than the Caucasian nose, and hence the technique of derotation grafts where air cartilage is being utilized was deducted. The primary outcome to compare these two to know which graft to best use was to look at unsatisfactory result as assessed at 6 months or more by a surgeon. Secondary, they looked at the outcome of anthropometric comparative analysis. In the primary outcome, the tick columellar deviation was slightly higher in the septal extension graft group as compared to the derotation graft group, but it did not have statistical significance. On the other hand, looking at tip droop and supertip deformity, there was a statistical difference which was worse in the derotation graft group than the septal extension graft group. Of their secondary outcomes, both groups had improved nasal tip projection, columellar labial angle, and there was really no difference between the two groups. In this paper, they also outlined their algorithm for deciding which patient is best suited for which graft, which is beautifully outlined in one of their figures, among many others. I think this is great because it allows other surgeons to actually follow their algorithm and come up with a plan as to whether they should use septal extension graft or a derotation graft. Please read it in PRS.